Here are 3 exercises that I find that most patients have really good success with if they've been dealing with chronic low back pain. The first exercise is to really make sure that the pain is actually coming from the low back and not coming from the hips. So what you're gonna do, you're gonna come into a 90-90 position here. What I want is 90-degree angle at the front hip, 90-degree angle at the back hip. Where people will start to feel low back pain in this, and if the hips are actually a problem, is that they'll start to dunk into the low back. So see how if I'm in this position, I'm actually dunking into the low back. To change this, what I need to do is be able to rock back, take the back pocket on this hip and shine it towards the back of the knee, and then hold. That typically will clear up people's low back pain when they're in this position and if this back hip is causing some of the pain. When it comes to the front hip, there's also that same issue where the knee may come up because I can't actually have that external rotation in that front hip. So it'll occasionally look like this. How we can fix this one is really start to rock into it. We can also rock out of it and really try to use the trunk as a leverage to figure out what position is going to feel best for the low back. Another thing that we need to rule out when it comes to the low back is actually the mid back. So a lot of the times when people have low back pain, they actually don't move well through their mid back. So a way that we can assess that is we're going to sit back onto the heel. We're going to come hand behind head. We're going to go elbow to elbow pit and then rotate up as high as we can. Okay, so we're going to do that 3 times. And as we're doing this, I want us to check side to side if one side is harder than the other. So for me, my left side tends to be a little bit more challenging. So what I'm going to do when I find that out, a lot of the times motion is actually medicine. So we can do some more of those, or what I like to do sometimes is actually come up to the wall, hand on wall, reach over as far as I can. As I do this though, what I want to act like is that my hand is getting pulled this way as my other hand is getting pulled this way. So I get some rotation through the mid back, but I also get some rotation through the ribs. Another thing we find is that the low back either moves too much or doesn't move enough. So if the low back is doing too much of the work, a lot of these other exercises are really good for it. And that is where some of the core exercises might be helpful, or making sure that the mid back is moving, the hips are moving well. But if the low back doesn't move enough, we also need to make sure that we give it some more motion. So a movement that I like to do when the low back isn't moving enough is going to be something like a drunken turtle. So this is going to be to promote more flexion into the low back. What I'm going to do, I'm going to come into this position here. Knees are going to tuck up. From here, I'm going to rock back and forth. Okay? So I'm actually getting a little bit more of that core to turn on, but I'm promoting some of that flexion into the low back. Okay. So I'll do like 10 reps of that. If you found these exercises helpful, go ahead, let me know. If they don't work for you, that is fine as well. It just might not be the solution to your problem. There is other things out there that we can give you to help promote some more movement. If you found that these exercises were helpful but didn't help the full picture, you're more than welcome to come in for a free visit.